So we're going to give you the real nuts and bolts of detoxification. We live a detoxifying life, right, Dr. Casen?
We do. And before we begin, I want to make sure that anyone out there that's watching us, that you are going to get a free gift today. And as whenever you're watching this, wherever in the world, all you need to do is you need to email us at customercare@druglessdoctor.com. And in the subject, write free PDF, and you're going to get a free PDF of Dr. Bob's Guide to Detoxification. So you're going to get this information for free in your email. You just go ahead and put in the subject free PDF at customercare.
That will change your life.
Yeah, so let's get started, Dr. Bob.
Okay.
Why is springtime the best time to detoxify?
You know, it's kind of interesting you bring that up. Well, many years ago, I was speaking with my colon therapist, and she was doing colonics, and she was very specific, said to me, the best time to cleanse is between March 15th and Memorial Day. And if you think about animals out in the wild, they go from their dark, dingy fur coats and it's very vibrant. Everything changes from that dull wintertime, even the buds in the ground. And it's just vibrant and the whole body is reacting. And even snakes and other types of animals and reptiles, they shed skin.
They do, and out there you're smelling the fresh flowers. So think of just cleansing your body, which feels so good. I know, and what would you say, Dr. Bob, what are the most effective ways to cleanse your body? And I know we have a lot of fun props here for all of you.
Well, you want to know something? The simplest way to detoxify your body is to make sure you drink water. Now I'm going to be specific. You want to drink pure water, not tap water, not alkaline water. You want to drink pure water. We drink reverse osmosis water, and you try to get as much of it in your body as you can, because I know some of you are going to say, well, how much? Even a little bit more than what you're doing right now. I happen to have 2 bottles that I make sure I work on every day that are stainless steel bottles, and it really makes a difference. You should be pooping, by the way, twice a day in the morning, at least 2 times. So I had somebody I was asking today, here, this is the funny question.
Hang on a second, let's just see. Did you say 2 to 3 times a day, Dr. Bob? Some of these people out here are thinking, is that normal? And I've even heard people in our office say, I don't have time for that, Dr. Casen.
If I ask somebody if they poop on a regular basis, if they don't answer, they don't. And there's 2 things that they're not doing. They're not drinking water, and they're not eating
green vegetables, and these are fresh green vegetables. So I know we have, vegetables, and you want to increase all those nutrition foods. But you were going to talk about a story, I think, Dr. Bob.
Okay, I don't remember what the story was because I've got so many stories inside of my head. But arugula, anything green, and the reason that green is so important is because it has magnesium in it. So let's kind of shift gears a little bit and talk about what else were you going to ask me about?
Okay, so this is really important. Let's talk about the liver, which we have 2 different livers here.
So the liver is located right here in your body, right underneath your right rib cage. So this is what a normal liver would look like.
And then here, so if you see normal, and then this is a fatty liver, which 8 out of 9 people have a fatty liver.
A lot of fatty livers today.
Or sluggish liver, and then this is like what you would think of like cirrhosis of the liver. But a lot of you out there, even that are watching us online, you have a sluggish liver, and we know that because you could be tired all the time. Maybe if you're a woman, you have tender breasts, a heavy menstrual flow, hemorrhoids, constipation,
skin tabs, varicose veins, bad breath. All of that is a part of you're being toxic.
Crying easily. Also, if you're a male and an enlarged prostate, I know we see that very often as well.
Amazing. What's fine also is that we have a tool in our office, which is a heart sound recorder, and we happen to do one today on an individual who had their gallbladder out. Okay, so the gallbladder is located right here on the liver. Well, this individual had the gallbladder out, and on our heart graph, you could literally see a hesitation of blood flow impacting the heart. See, the blood flows up through your legs, through this little tube here called the inferior vena cava, and it leaves here and it goes directly into the heart. And because she had her gallbladder out, it wasn't that the gallbladder being out causes the heart to be off rhythm. It's because their liver is compromised, Dr. Casen. Because blood has to flow through the liver on the way to the heart.
So we talked about increasing water in your life, increase the fresh vegetables, the proteins I know, but also we talk about this a lot. castor oil. So why
Do
did
you drink this?
You do not drink this.
Good.
I hope.
Somebody was saying,
Do you?
No, I don't.
But I do know that some people, when we ask them in our office, have you ever heard of a castor oil pack before, they go, I've heard of castor oil, but not a pack.
Yeah, my grandma used to drink it.
What
she didn't really, but that's what they say.
They do. So you don't want to drink it. But what's really interesting is you use this wool flannel, which we have this in our office, and you literally will drizzle the castor oil.
If you notice, this is brown. It's like this is the original color, and you just squirt it on there a lot, get it saturated, and you place it underneath your right breast, right where your liver is at, because a lot of people don't realize you're going to put it right here on top of your liver. Now, you're going to have, of course, no clothes on. You put the castor oil pack on your skin, then you could put a plastic on top of the castor oil flannel and put your heating pad on for about 45 minutes. And then when you're done with that, you can put it in a Ziploc bag and you can put it in your refrigerator, and then you could put it in your oven the next time for about 10 minutes at 200 degrees. But literally what the castor oil does is it kind of squeezes that liver so it functions optimally. And I have people tell me that has changed their lives, the castor oil pack.
And if you're a female, especially if you have a heavy menstrual flow, tender breast, I know working on helping to clean up the liver, it helps to actually purge toxins. So the only time you wouldn't want to do this is during your menstrual cycle or if you were pregnant or breastfeeding, but everyone else really could benefit from incorporating the castor oil pack.
I just want to show everybody the intestines. So we have the small intestine and the large intestine. In all seriousness, you want to poop at least twice a day. If you have a subpar thyroid gland, you may have difficulty having a bowel movement. Let's talk about the breast, and I think this is really significant. I'll hold it up for you.
So it's really interesting, and we've learned so much in regards to detoxification in the body, and your breast is a representation of what's actually going on the inside of your body. So if you're a female, you could have tender breasts, you could have lymph congestion, larger breast tissue. I know especially right now we see a lot of women that have breast augmentation.
Yeah.
Recently an article came out sharing that mammograms are not recommended, that they do not have them on a yearly basis. So I know this is something that is really important for every woman to consider, is breast thermography. And I know our dates are coming up on April 30th as well as May 3rd and May 7th, and that's going to be in our Westlake office. So if you're looking for a different approach without radiation and you want to see what else is going on, it's definitely an opportunity to see how your body can.
And I think what's so significant about the breast is that the breasts drain into your armpits. And if your armpits are congested on the thermography, it's a body signal to us that your liver's not functioning optimally. And I know that our time is speeding by. We're going to talk about the ever famous ABCs.
Yes, go for it.
A half a red apple every day. That'll help thin bile. This is the amount of beets you want to be eating on a regular basis. I'm going to be eating this tomorrow for my lunch. A carrot. The carrot itself gives your body the precursor to make vitamin A, and radishes. I eat this every day. It helps support optimal liver function. What about a PDF? We're giving away something?
Yes, so all of you that are watching, make sure you email customer care at druglessdoctor.com. Put in the subject free PDF, and you're going to get a free PDF of Dr. Bob's Guide to Detoxification, which all of us can be working on detoxification, especially right now in the springtime, and then in the fall is a great time also.
So we're drugless doctors. Drugs can cause, medication can cause your liver to be compromised because your liver has to handle it. Even statin drugs, one of the side effects is liver disease. So this is Dr. Bob and
Dr. Casen DiMaria.
Thank you for joining us.